Good afternoon or good evening, depending on where you might be. My name is Kevin Michael Grace, and this is the KMG show. Let's talk about female health commissars. They get things done, crushing the economy, destroying society, stripping us of our civil rights. It's all in a day's work for these noble slay queens. A somewhat remarkable piece in Toronto's Globe and Mail on Saturday. And it's by Gary Mason, who is a three-time National Newspaper Award winner. And it's called Dr. Bonnie Henry's 3 Dark Days, how BC's coronavirus course was set over 72 vital hours. At the end of the story, there is an illustration by Jeannie Brito, which can only be described as hagiography. She is a saint, this woman. There are pictures of her appearing in public because this is the woman who has prevented us all from dying, apparently. When Dr. Bonnie Henry thinks back to the first nerve-wracking weeks of BC's response to the COVID-19 emergency, the provincial health officer recalls a 3-day span in which she couldn't sleep. The novel coronavirus epidemic arrived on Canadian shores in the early weeks of January. British Columbia became newsworthy as the province with the most cases. Dr. Henry, until then a mostly anonymous civil servant, became the public face of the government's response to the crisis. Having worked for the World Health Organization, and that certainly inspires confidence, doesn't it? And Toronto Public Health, she was experienced fighting SARS, Ebola, and H1N1. But this was different. She was now in charge of directing the strategy. As the virus began to spread in the province, lives were being lost. More were on the line. With thousands of people set to head off on spring break, she suddenly felt the burden of her responsibility. I would say March 11th, 12th, and 13th are key dates for me, Dr. Henry said. I don't think I slept at all any of those nights. You're wondering, are we doing enough? Are people going to say we're overreacting? Those were certainly some of the things that were going through my mind. It was in that 72-hour period that Dr. Henry and top political and medical officials made decisions that helped put BC on a relatively quick path to flattening the growth of the novel coronavirus in a way that provinces such as Quebec and Ontario were not able. Well, the curve, the famous curve, has been flattened. So we're going to go back to normal, right? No, we are not going back to normal. There is no normal left. We're heading into a new normal, and I'll have something to say about that a little later. Let's see, throughout the early weeks of the new world, it's a new world, she was helping British Columbians navigate, Dr. Henry remained a reassuring voice. She wasn't afraid to show a vulnerable side. At one news conference, she teared up while discussing the impact the disease was having on families at long-term care homes. She was praised for demonstrating a level of empathy rarely conjured by public officials. It was the point at which Dr. Henry became a fixture in the consciousness of most British Columbians. An artist painted an image of her and Dr. Theresa Tam on the boarded-up storefront in Gastown. Her love of John Flugog's shoes, which were evident every time she strode to the podium to give her daily update, became a provincial talking point. The designer, in turn, decided to honor her by designing a shoe in her name, embossed with the words she often used to end her news conferences: be kind, be calm, be safe. While flattered by all the attention, Dr. Henry has remained singularly focused on the monumental challenge before her and changing the rules of engagement along the way. It's definitely inspiring, wouldn't you say? So what about Dr. Theresa Tam, the expert from Hong Kong? Canada's top doctor says there isn't enough evidence to back herd immunity as a way to reopen society, as Quebec's premier is considering the approach to restart his province's economy. The idea of generating natural immunity is actually not something that should be undertaken, Theresa Tam said Saturday, urging people to be extremely cautious about the concept. Herd immunity is conferred when enough people in a given population have been infected with a virus, marking them immune to reinfection and slowing down the rate at which the virus spreads on its own. The World Health Organization, that august and universally respected institution, published a brief Friday saying there is currently no evidence that people who have recovered from COVID-19 and have antibodies would be protected from a second infection, but clarified Saturday that most people infected would end up with some level of protection. So when is the lockdown going to end? Apparently never. So we'll be hearing much more from those slay queens, Bonnie Henry and Theresa Tam. The Guardian writes, are female leaders more successful at managing the coronavirus crisis? I guess that have to be a yes, right? Plenty of countries with male leaders have also done well, but few with female leaders have done badly. So they talk about Sylvia Jacobs, the Prime Minister of Sint Maarten, which has 41,500 people. Simply stop moving. If you don't like the bread you like in your house, eat crackers, eat cereal, eat oats, eat sardines. It mentions the Prime Minister of New Zealand, Jacinda Ardern, whose blunt message exemplified firm action, effective communication, and showed another female leader getting the job done. From Germany to New Zealand and Denmark to Taiwan, women have managed the coronavirus crisis with aplomb. Plenty of countries with male leaders, Vietnam, the Czech Republic, Greece, Australia, have also done well, but few with female leaders have done badly. Ardern, 39, New Zealand's premier, has held Kiwis' hands throughout the lockdown, delivering empathetic stay home, save live video messages from her couch and communicating daily through non-combative press conferences or intimate Facebook Live videos, her favorite medium. Her insistence on saving lives and her kindness-first approach, urging New Zealanders to look after their neighbors, take care of the vulnerable, and make sacrifices for the greater good, has won her many fans, while her emphasis on shared responsibility has united the country. And they drag Angela Merkel into this, Mette Frederiksen, the Prime Minister of Denmark, who managed to show a sense of fun, posting a clip on Facebook of herself doing the dishes while singing along to the 1980s Danish popsters Dodo and the Dodos during the nation's weekly TV lockdown sing-along. The nation's weekly TV lockdown sing-along. That is quite possibly the most sinister thing that I have ever heard. The Guardian article mentions Taiwan's President Tsai Ing-wen. Yes, and are all these women doing the same thing? Well, they are women, so I guess they must be great. From the Off Guardian, this week in the Guardian Coronavirus Special. In the last couple of days, 2 separate articles have appeared talking about gender, leadership, and how to correctly steer your country through a pandemic. Apparently, women are inherently better at doing this than men. There's this one about terrible, mean, brutish, hairy male heads of state being awful and handling the pandemic badly, and this one about compassionate, friendly, educated, nice-smelling female heads of states being lovely and doing all the right things. It really is as reductionist as that. The only thing any of the leaders have in common is their gender. Though loosely described in the first article as populist, the male leaders listed don't all agree with each other, haven't enforced the same policies, or all handled the coronavirus outbreak in the same way. Strict authoritarian moves in Hungary and the Philippines are listed alongside the virus denial of Bolsonaro in Brazil. Likewise, the women don't have nothing in common but their chromosomes. They don't all share policies or backgrounds or education. Jacinda Ardern's hard early lockdown is listed alongside the less stringent measures of Merkel and the comparatively non-existent lockdown in Taiwan. They all did the right thing, apparently, despite all doing different things, simply because they all did them whilst having a uterus. Takeaway point, the really bad thing about populism is that men do it, but when women do it, that makes it all right, just like everything else. Another Guardian article from this week warns of pro-Kremlin outlets spreading coronavirus disinformation. Nick Cohen, yeah, that guy, has an op-ed on the same subject urging action against free speech so that Russian meddling doesn't persuade us all to break quarantine and rush outside like lunatics. He spent the last 4 years comparing Jeremy Corbyn to Stalin, and now he's arguing that Facebook and YouTube should do some Stalinist censoring of their platforms in line with government policy. Has no one at Grand HQ even noticed that the Kremlin, as well as China, is actually in lockstep with the West on the issue of COVID-19? Or does no whisper of reality percolate through their glassy walls anymore? Pro-Kremlin and pro-China are labels which have literally lost all meaning in the face of an almost totally unified global response to COVID-19. And yet, if Nick has his way, they will be used to destroy any semblance of alternative media in Western society. His article's headline, "Social Media No Longer Tolerates Toxic Lies, Don't Believe a Word of It," makes the intent plain. He is returning to the theme that big tech companies have to do their part to make sure Russians and conspiracy theorists don't harm our society. But this time he is overtly demanding wrong-thinking people, specifically David Icke, should be unpersoned and barred from social media to protect public health. At one point in his incoherent diatribe, he even cites conspiracy theorists' alleged anti-Semitism without any evidence to back it up. A beautiful example of what Huey Long called fascism coming in the name of anti-fascism. Nick doesn't care about that. He's just here to promote authoritarianism and chew gum, and he's all out of gum. So, you may have heard, well, before I get to that, we live under a dictatorship of experts. And The Guardian has attacked the credibility of the recent California-based studies which found coronavirus antibodies to be far more widespread than previously estimated, lowering the infection fatality rate by at least a factor of 10. According to The Guardian, scientists and experts have criticized the study. The fact that people who carried out the research were also scientists doesn't seem to matter. With their questioning of the virus, they have been thrown out of the priest caste and are tainted with heresy. The basic tools of bias are pretty evident. Every expert calling the controversial studies into question is named and their qualifications listed. Only one of the authors of either of the research papers is even named, Dr. John Ioannidis, and his qualifications are not listed, nor is he directly quoted. Accepting his controversial opinion that COVID-19 is not the apocalyptic problem we thought, when that is the quote they trot out to make you look irrational, you're a very rational man. Nowhere does it mention that no expert anywhere questions that upwards of 80% of coronavirus infections are thought to be asymptomatic, right in line with these studies' results. Nor does it mention any of the other studies showing that WHO's official CFR is significantly overestimated. At one point, the authors even accidentally argue against their own point, citing the fact reported COVID-19 deaths were recently found to have started in California in early February, without realizing this is a major argument in favor of the study's conclusion. Obviously, the earlier the disease reached the US, the more it will have spread by now. But the most hilarious part is that criticism of antibody tests used in the research because they have a reported false positive rate in 2 in 371, or 0.53%. Hilarious because the PCR tests used to diagnose coronavirus infections, despite the inventor of the test stating it should never be used diagnostically, has a potential false positive rate of 50%, or even as high as 80%. And elsewhere, the Guardian manages to spread the news that you've heard all about these frontline people who have been killed by coronavirus. Yeah, when it includes dentists and receptionists and the like, it turns out that these numbers have been faked, just like the other numbers. You would think that the way that the media is carrying on about these medical ladies, the lady commissars, that they were, modern day examples of Paul Ehrlich, who cured syphilis, or Jonas Salk, who came up with the first polio vaccine, or Albert Sabin, who came up with the oral polio vaccine. These men saved millions of lives. Bonnie Henry, Theresa Tam, and the rest are not saving millions of lives. They have ushered in a situation where large numbers of people are going to die because it's difficult to live, you know, in the modern world without a functioning economy. Oh, yes, and in other doctor news, I was recently alerted to the existence of Dr. Carol J. Baker of the Baylor College of Medicine and Texas Children's Hospital, who is formerly a high official in the Centers for Disease Control. And here she is on video saying that white people should be eliminated in the United States because it turns out that non-white people are far more likely to want vaccinations. How about that? Oh, Dr. Neil Ferguson, why are we still listening to this madman? According to The Sun, Britain could see 100,000 deaths if the lockdown is lifted too soon. Professor Neil Ferguson warned it would be impossible to send some people back to work without seeing a huge increase in deaths. Yes, his comments come as Dominic Raab admitted a coronavirus vaccine is unlikely to come this year. Now, it seems likely to me that in this rush for a virus, normal evidentiary standards are likely to be tossed aside. So we could be looking at a self-induced catastrophe with large numbers of people dying from a dodgy vaccine. Neil Ferguson, of course, has been proved wrong again and again and again, but he's still a top expert. Let's see, Alex Berenson writes, so we all know Neil Ferguson is not a medical doctor, right? Turns out his PhD is in theoretical physics, which has about as much to do with treating living patients or public health in general as a PhD in comparative literature would. Maybe Professor Panic, not Dr. Doom? Oh, yeah, I'm going to talk about China, and I have a hypothesis. But first, let's check on the chat. The mic sound is a bit off. YT says, people need to stop with this public tearing up. Why is everyone crying for all to see nowadays? What is this new tears fetish? Well, it proves empathy, I suppose. And again, we are hardwired to be sympathetic to crying women. And it's a trick that women have long employed to get their way. William Hicks says, with all this Biden stuff, I'm reminded of that great scene in The Verdict when Lindsay Krause lets James Mason know that she kept a copy of the form she wrote the one on. Yeah, Joe Biden is apparently, I suppose, in a lot of trouble because a woman named Tara Reid has accused him of sexually molesting her. And now it turns out that Tara Reid's mother called the Larry King show on CNN contemporaneous with these events and said that her daughter had been molested by a powerful American politician. And Google View has removed that episode of the Larry King show. So if you want to hear it, you can't get it from Google. Google, of course, they're in no way partisan. You know, it's not as if they prefer the Democrats and hate Donald Trump. No. So if Biden gets COVID-19 and dies, who's going to be the nominee? I just think that the Democrats they're just hoping that Biden lives and that no one notices that he's a senile buffoon. Because, you know, the fact that he's accomplished nothing in his political career, I suppose that's not particularly important. Yako Raipala says, our female leader tried to make herself a dictator, but our system has successfully resisted. A lot of the stuff like roadblocks locking us all into Helsinki were ended as unconstitutional. Metal Mike says, don't ban Ike. I want to hear about the reptilians. Ian Chadwick says, Neil Ferguson has been a joke for years, making fun of his thousands of lines of undocumented C code before it was cool. How has the ear of anyone is the question. Contra Coup says, not all health professionals are for this lockdown, KMG. We are being thrown under the bus to provide cover for the inept public health experts. Yes, this is true. And I will get to that shortly. The comedic truth says, have you left your room, KMG? Well, as you could see, I am actually in a hotel room here and have been for 2 weeks. Here's my hypothesis about COVID-19. Call it a conspiracy theory if you like. But this virus originated in Wuhan, China. And the Chinese did not handle it very well. They allowed 500,000 people to leave Wuhan and to spread it. They banned all internal flights in China, but allowed Chinese to fly all over the world. Their initial line, which was picked up by the World Health Organization, which is led by an Ethiopian communist, was that COVID-19 was not a particularly big deal. There was no evidence that it was communicable person to person, and that the real enemy was xenophobia and its attendant stigmatization. That was their story, and they stuck to it for as long as they could. And then it became inoperative. So the World Health Organization and Dr. Theresa Tam and everyone else, they turned on a dime and said, oh my God, we're all going to die. And everyone must be locked down, well, forever, or until there is a vaccine. And my hypothesis is that the Chinese are behind the we're all going to die story, because after their initial cover story had failed, they decided that they and their fifth columnists in the West, of whom there are many, decided that this new disaster story could be used to destroy the economies of the Western countries, which is exactly what has happened. Let's see, Trump's WHO funding freeze during coronavirus pandemic gives China an opening to expand its influence. Yeah, because we need more China in our lives, apparently. This is from the Washington Post by Emily Rauhala. Days after President Trump announced he would freeze U.S. funding to the World Health Organization, China made a very different statement, a $30 million pledge to the group. Trump and his allies argue the WHO's response to the novel coronavirus has been ineffectual and China-centric, and some outside the administration agree. But his largely unpopular decision this month to suspend funding to the Global Health Agency for 60 days in the midst of a pandemic could have impacts that reverberate beyond the current crisis. His largely unpopular decision. Do Americans particularly like their tax dollars going to foreign institutions, such as the United Nations, the World Health Organization? Do they particularly like foreign aid? I don't think that they do. And I don't think Trump's decision was actually largely unpopular. It was largely popular amongst other world leaders and members of the elite, but that is not the same thing. So this event apparently enhances China's standing in the world while reinforcing perceptions of the United States as an unpredictable partner. This is in the Washington Post. China lied and lied and lied again about COVID-19, but apparently they come out of this smelling like a rose. Trump called the media the enemy of the people, and he could not be more right. In the shorthand, Trump's decision hands Beijing a propaganda victory, bolstering its campaign to deflect attention from what happened in Wuhan and recast the crisis as evidence of China's competence and cooperative might. Yes, their competence, which is why roughly half of the masks and the like that they are selling to the rest of the world are defective, because the Chinese are so competent. It's too funny. A foreign ministry spokesman said the donation showed China was defending the ideals and principles of multilateralism, a not so subtle swipe at Trump's frequent attacks on globalism. Yes, apparently there are diplomats out there who are upset with Donald Trump. I had no idea that was the case. I suppose we should all forget the DOJ, FBI, CIA coup attempt against Trump. And from the Daily Mail, how Europe pandered to China in wake of outbreak. EU officials watered down report on China's coronavirus fake news campaign after pressure from Chinese leaders, with stacks of findings edited out. The New York Times and the South China Morning Post say original copies of a major disinformation report claimed China was deflecting blame for the outbreak. It was edited after EU diplomats were warned of repercussions. What are the repercussions? That they're not going to be paid off anymore? That China is no longer going to be allowed to sell its cheap tat in the West? Hang on a sec. Someone called George Eaton writes to Toby Young, the problem with easing the lockdown because hospital deaths have fallen is that they've fallen because of the lockdown. Toby Young responds, according to Carl Hennigan, professor of evidence-based medicine at Oxford, infections peaked on March the 18th, 5 days before the lockdown. The social distancing measures introduced by the government on March 16th were sufficient. No need for the lockdown. As I've pointed out many times, there is no way that it could be demonstrated that the lockdown, the so-called mitigation, has been effective, because we don't know how many people had been exposed to the coronavirus in March, February, January, December, or perhaps even earlier. And Peter Hitchens, again, cites Professor Hennigan that the infections peaked on the 8th of April. And again, no evidence the shutdown works or was even necessary. And he has provided a graph showing a huge spike and then a tremendous fall in infections. Deaths peaked on April the 8th. It is vanishingly unlikely that this peak resulted from the March 23rd shutdown. I mentioned the Ethiopian communist who is the head of the World Health Organization. Paul Joseph Watson writes, despite its complicity in helping China cover up the severity of the coronavirus pandemic, the head of the World Health Organization today claimed the world should have listened to the WHO. Tedros Adhanom Ghebreyesus told a virtual press briefing that the WHO told the world the COVID-19 outbreak constituted a public health emergency of international concern on January 30th, when there were only 82 cases registered outside China. The world should have listened to WHO then carefully, he asserted. The sheer inaccuracy of these statements would be funny if not for the fact that lives were lost due to the WHO's mishandling of the outbreak. At every step of the way, the WHO praised China's actions on coronavirus, despite widespread evidence that the virus was leaked from a lab, that Beijing lied about the true fatality numbers, and had known about coronavirus at least weeks before it informed the WHO. On January 14th, the WHO amplified Chinese government propaganda that there had been no human-to-human transmission of COVID-19, despite this having actually occurred back in November. According to sources who told Fox News that the virus was leaked from a lab in Wuhan, this represented the costliest government cover-up of all time, and the World Health Organization was complicit from the beginning in helping China cover its tracks. The WHO also blocked doctors from urging countries to impose border controls to stop the spread of coronavirus, and repeatedly told countries not to close borders, despite this being an effective way of controlling the spread of the virus. Right up until the end of February, the WHO continued to advise against the application of travel or trade restrictions to countries experiencing COVID-19 outbreaks. A Mount Sinai study found that New York City's record high coronavirus cases and deaths were predominantly due to travel from Europe, meaning that many more lives could have been saved if borders had been closed down earlier. But instead, the WHO insisted that maintaining the globalist principle of the international traffic of people was more important than stopping a global pandemic. The organization also repeatedly told countries not to profile Chinese people in order to avoid stigmatization, something that almost certainly led to a lack of screenings of Chinese people passing through airports. Given this history, more lives would have been saved if countries had in fact listened to the World Health Organization a lot less. An interesting story from the Asia Times. Why the US outsourced bat virus research to Wuhan. US-funded $3.7 million project approved by Trump's COVID-19 guru, wait for him, Dr. Anthony Fauci, in 2015 after US ban imposed on monster germ research. This is, I don't know. Was this all planned? I don't know. I'm beginning to get, as I mentioned earlier, I'm beginning to get the idea that perhaps it was. In October 2014, the U.S. government had placed a federal moratorium on gain-of-function research, altering natural pathogens to make them more deadly and infectious, as a result of rising fears about a possible pandemic caused by an accidental or deliberate release of these genetically engineered monster germs. This was in part due to lab accidents at the U.S. Centers for Disease Control and Prevention in July 2014 that raised questions about biosafety at U.S. high containment labs. At the time, the CDC had closed 2 labs and halted some biological shipments in the wake of several incidents in which highly pathogenic microbes were mishandled by U.S. government laboratories, an accidental shipment of live anthrax, the discovery of forgotten live smallpox samples, and a newly revealed incident in which a dangerous influenza strain was accidentally shipped from the CDC to another lab. So apparently this can't be done safely in the United States of America, so let's farm it out to China, a country which is known for its general incompetence and its scoffing at safety features of all kinds. I'm waiting for criminal indictments, but of course there weren't any after much of the world was lied into the invasion of Iraq. Factcheck.org, which is a project of the Annenberg Public Policy Center, asked the question, are hospitals inflating the number of COVID-19 cases and deaths so they can be paid more? Recent legislation pays hospitals higher Medicare rates for COVID-19 patients and treatment, but there is no evidence of fraudulent reporting. Are hospitals getting $13,000 per patient if they write that on the if the diagnosis is COVID-19 on the patient's chart, and $35,000 for each patient if they are on ventilators? A Minnesota state senator's recent interview on Fox News about Medicare payments for COVID-19 hospitalizations has generated a frenzy of headlines on social media, suggesting that all hospitals may have a financial motivation when it comes to classifying cases or deaths as related to COVID-19. The initial comment was made by Minnesota State Senator Scott Jensen, a family physician. He said, I would remind people that anytime healthcare intersects with dollars, it gets awkward. Right now, Medicare has determined that if you have a COVID-19 admission to the hospital, you'll get paid $13,000. If that COVID-19 patient goes on a ventilator, you get $39,000, 3 times as much. Nobody can tell me after 35 years in the world of medicine that sometimes those kinds of things impact what we do. In an interview with factcheck.org, Jensen said he did not think that hospitals were intentionally misclassifying cases for financial reasons. So as we have learned, these ventilators are widowmakers. They kill the vast majority of people who are put on them. And it turns out that hospitals have a $22,000 inducement to do so. So it's hardly surprising. According to USA Today, 1 in 3 death certificates were wrong before coronavirus. It's about to get even worse. As the U.S. struggles to track coronavirus fatalities amid spotty testing, delayed lab results, and inconsistent reporting standards, a more insidious problem could thwart the country's quest for an accurate death toll. Between 20 and 30% of death certificates nationwide were wrong before COVID-19. Bob Anderson, chief of the Mortality Statistics Branch at the National Center for Health Statistics, said in an interview, I'm always worried about getting good data. I think this sort of thing can be an issue even in a pandemic. Let's see, a review of Missouri hospitals in 2017, for example, found nearly half of death certificates listed an incorrect cause of death. A Vermont study found 51% of death certificates had major errors. Death certificates regularly lack enough details to accurately pinpoint the cause of death. For example, cardiac arrest is not an acceptable cause of death because everybody dies of cardiac arrest. That just means your heart stopped. So how many people have been exposed to the coronavirus? It appears quite a few. This is a story from Axios. 96% of the 3,277 inmates in state prison systems in Arkansas, North Carolina, Ohio, and Virginia who tested positive for the coronavirus did not show symptoms. So, we were told that coronavirus, COVID-19, was a disease which just put people flat on their back. Well, it puts some people flat on their back, and it killed some people, but these were overwhelmingly old, otherwise unhealthy people. Let's see why it matters. The findings suggest that asymptomatic patients could be contributing to the spread of the virus at a far higher level than suspected, especially in prisons. This is especially noteworthy because health officials have prioritized testing and surveillance for people that show symptoms. It adds to the understanding that we have a severe undercount of cases in the U.S. Leanna Wen, Adjunct Associate Professor of Emergency Medicine at George Washington University, told Reuters. Yeah, how about that? My guess is that the vast majority of people in the United States and Canada have been exposed to coronavirus. And a great number of people have had it, and most were asymptomatic. In a just world, Governor Andrew Cuomo would be facing hundreds of charges of manslaughter. But no, he's the love gov. Apparently, he is one of the heroes of this crisis. Why do I think that he should be facing manslaughter charges? Because he forced infected people into nursing homes. That's right. Oh, and it's the nursing home's fault because they didn't have the proper equipment, the proper procedures, room to keep the newcomers separate. Well, yeah, that sort of thing happens when you don't check the conditions. So how many people have this in New York State? Coronavirus antibodies present in nearly 25% of all New York City residents, Cuomo says. How about that? All of the evidence that we're getting shows that coronavirus is far, far, far less lethal than has been claimed. As I mentioned last week, the two doctors in Kern County, California, based on their testing of thousands of people, they have come up with a death rate of 0.03%, which is substantially lower than common influenza. Oh, here's a deep thought from the LoveGov. Everyone has to think outside the box because there is no box. People have all started talking like prophets now, or like madmen. There is no box. I responded to the governor, perhaps you should think about the thousands of nursing home residents you condemned to death by forcing their residences to accept COVID-19 infected patients. I wonder if Cuomo is losing any sleep over this. This is a story from NBC News. The coronavirus patients began arriving the last week of March, transferred to the Gerwin Jewish Nursing and Rehabilitation Center under a New York State mandate requiring nursing homes to accept those recovering from COVID-19, even if they still might be contagious. At the time, the Long Island nursing home had only one known resident who had contracted the virus. A month later, Gerwin is battling an outbreak that's killed 24 residents, only 3 of whom were hospital transfers and 1 staff member who worked in housekeeping. And the nursing home is still mandated to take in recovering hospital patients known to have the virus, potentially increasing its spread in the facility. We can't say for sure whether the virus has spread because the patients transferred under the state mandate, but it's certainly not helping the situation, said the facility's CEO, Stuart Almer. Well, I don't know. Correlation is not causation, of course, but yeah, I think we know what's happened here. And could it be that authorities across North America decided that there were too many really old people around and they were draining the government in medical costs, care costs, pensions, etc. And it was time to start culling these people. These actions in New York and other states, as I said, can only be described as criminal. Now, let's go back to the chat, see if anything is happening there. YT says, is Cuomo going to compensate me for the lost income for the plans I had for this year that are not going to happen due to the loss of income? What a power-drunk prick. Middle Mike says, can we turf the idiot? Oh, there's someone trolling. Okay, a whole bunch of deleted messages, and this fellow has been timed out. Okay. YT says, imagine if Trump did that with nursing homes. Well, yeah, they're calling Trump a murderer now, calling this the Trump virus. And the Washington Post is telling us that China is just going to be so much more powerful and influential because the lipped one says, Kevin, barbell-shaped nipple rings give Cuomo a pass on pretty much anything he does. What about Fauci's take on AIDS, that heteros were going to die from it in massive numbers? Well, I don't know. I mean, Fauci is, it's impossible to get rid of him. Almost everyone associated officially with the AIDS pandemic was drastically wrong in their predictions. Tens of millions of people were needlessly scared to death, and I don't recall any apologies from these people. Will Johnson & Johnson get the vaccine patent? Asked Metal Mike. Who earlier asked, who were some of the participants of Event 201? Bill Gates, Chinese, CDC, Hopkins, Johnson, and Johnson. A little joke about me and Teresa Tam. My real name is Cam Mingon. No, I certainly don't look Chinese. Hey, what about the angelic a cappella music? Yes, I forgot, and I apologize for that. It won't happen again. So, what's happening in the financial news? Stock futures flat after Monday's rally on hopes for economy reopening. Leading stocks were Keurig, Dr. Pepper, F5 Networks, Tesla, and more. Purdue president's smaller classes, face masks may be part of fall semester plan. Yeah, I wonder how many colleges are going to be left standing. The Dow was up 350 points and it's closed above 24,000. Jeffrey Gundlach is shorting the market, says a retest of the low is very plausible. Texas to lift restrictions this week. San Francisco extends shelter in place through May. Yes, and San Francisco has been one of the least hard hit of the American states, particularly considering its population. In San Francisco, they cannot stop people in the thousands from evacuating their waste on the streets or shooting up on the streets, but they can lock everyone else in place. Alex Berenson suggested that the revolt, should there be one, might well begin in California. Oh, yes. On Sunday, there were 3 protesters in front of the BC legislature, which is a couple of blocks away from where I'm staying now, and they were protesting the sanitary dictatorship. One of them held a sign that said, "Nothing spreads like fear," and another one held a sign demanding the return of their God-given rights. And I thought that it was good to know that not all my countrymen are sheep. Nancy Pelosi says universal basic income could be worthy of attention now. Yes, people don't need jobs. Come on, what are you, living back in the Victorian era when we used to cover up piano legs because they were indecent? No, you just get your $1,200 a month check and get used to the taste of beans. Alex Berenson tweets, wow, Cuomo just announced the new New York City positive antibody results around 25%, up 3.5% from Friday. At least 1 in 4 New York City residents has already had and recovered from COVID. And what about the indeterminate tests, Governor? Well, yeah, Justin Trudeau said that it's not as simple or as easy as flipping a switch, to get things back to what they were. Well, it actually is just that easy. That you say all the lockdowns, all the restrictions are over. Go back to doing whatever you were doing before. That is to say, if you still have a job, if your company still exists. Another story from the Washington Post, which is quite worried. Catherine Shaver reports experts worry quarantine fatigue is starting. Researchers tracking smartphone data say they recently made a disturbing discovery. For the first time since states began implementing stay-at-home orders in mid-March to limit the spread of the novel coronavirus, Americans are staying home less. What? It's the novel coronavirus, it's the coronavirus, it's COVID-19, it's SARS-CoV something or other. I was talking to a friend yesterday about why this epidemic was treated differently than other flu-like epidemics. Well, perhaps one of the reasons is that it's the novel coronavirus. It's new, you see, and apparently it's unlike any other coronavirus in history, and everyone's going to die, except that we found out that no, that was a massive, massive whopper. But the politicians have committed themselves, and they're not turning back. The nationwide shift during the week of April 13th was relatively slight. However, any loss of momentum, particularly when stay-in-place orders remain in effect across most of the country, has some public health experts worried about quarantine fatigue. Any increase in travel, they say, is premature when staying home remains the most effective way to limit the spread of the virus until widespread testing and contact tracing become available. One, there is no evidence whatsoever that stay-at-home orders are the most effective way to limit the spread of the virus, if indeed we want to limit the spread. Contact tracing is a total joke, and anyone who uses that phrase with respect to COVID-19 should be ashamed of themselves, and failing that, they should be publicly shamed. We saw something we hoped wasn't happening, but it's there, said Lei Zhang, a lead researcher and director of the Maryland Transportation Institute at the University of Maryland. Yeah, check out that last name. It seems collectively we're getting a little tired. It looks like people are loosening up on their own to travel more. Zhang said he anticipates the number of people staying home will continue to drop as some states begin allowing businesses, beaches, and other public facilities to open. That process began last week in South Carolina and Georgia. Public health experts say any data showing widespread public resolve or cooperation beginning to wane is noteworthy, because this is the first U.S. pandemic in 100 years. No, it isn't. They don't know how long people are willing to tolerate cabin fever for the greater good. They say they're not surprised, however, the slide occurred in a week that saw the first highly publicized challenges to such orders by protesters and President Donald Trump, who tweeted his support to liberate states from shutdowns. The White House also released federal guidelines that week for states seeking to reopen their economies, and a growing number of governors, including in Texas, Minnesota, and Vermont, set dates for when they planned to gradually lift restrictions. You know, if journalists had not been designated as essential employees, I think you'd be hearing a very different line from them. They're still getting paid, and most of them are working from home. So, they're not like those schlubs who actually, are involved in the production and distribution of the food, drink, and consumer goods they love so much. Here's a story from Spiked, from Matthias Heitmann. We are moving towards a new normality. This is how Germany's finance minister, Olaf Scholz, put it at a coronavirus press conference last week, alongside Angela Merkel and various state premiers. The government was announcing its timetable to phase out the lockdown measures. Before it began, the conference had an almost religious feel. with those gathered seeming to wait for proclamation and guidance. During the conference, there was talk of a roadmap back to life, a return to normality, the restarting of society and the economy, and loosening up. When the nation has spent the past weeks crammed between the sofa, balcony, and bedroom come home office, people start to get hung up on these words. Finance Minister Schultz's statement on the new normality almost passed everyone by. Yet sometimes it is precisely the words that get the least attention that are the most noteworthy and which hide the hitherto unrecognized trends. What does this new normality look like? Who decided on it? And if we don't know what this new normality looks like, how can we tell if and when we are there? We, the public, cannot, because we are only passengers on this journey. We are even told that the exact timings will remain unknown, but any advances will depend on our good behavior. Keep your distance, fasten your seatbelt, and do not talk to the driver while he or she is driving. Then, and only then, can a new normality possibly be achieved, into which set pieces of the old normal can be built. I have good news and bad news. The bad news is that this planned return to normality is based on a disastrous double error. First, normality is neither a place we can leave or return to, nor is it a state of matter that can be changed. Whoever leaves normality gives it up. Whatever follows it is not normal. At the same time, politicians have a completely unworldly understanding of how normality arises. Normality does not adhere to plans and blueprints. It is the product of innumerable human processes. It grows from experiences, developments, grandiose victories, and painful ruptures. Normality only exists if it is filled with life by normal people. Today's situation deprives the public sphere and social life of its usual vitality. Conversely, it has promoted megalomania and fantasies of omnipotence on the part of politicians and state authorities. The successful spreading of fear and terror has strengthened our own willingness to obey, too. The question everyone is asking themselves all the time is, can I do that? In this climate, doubt and dissent are regarded as a source of danger, and suddenly restrictions that were unthinkable just a short time ago became real. The state of emergency eats away at normality. The mere idea of returning to normality from this anomaly with the help of a moderately timed timetable is itself deeply abnormal. The good news is that a new normality will develop, but not in the way that is envisaged by the government. By moving away from the old familiar normality and finding our way in new realities, we are slowly overcoming the rigidity caused by the initial shock, both in our actions and in our thinking. It is vital for democracy that the democratic sovereign citizen starts thinking for himself again. Now, I'm reminded here of immigration and multiculturalism. America's system was overhauled in 1965. Canada's system was overhauled in 1967. Canadians and Americans were not told that their countries would be transformed, and that, for instance, Vancouver and Toronto would become minority, where minorities would become a majority. If the Canadian and American people had been told in 1965 and 1967 that this was going to happen, they would have said no. They would have stopped it. But instead, our politicians lied to us. And this led to a situation where, there's a whole bunch of things, a lengthening list of things you can no longer say. Why? Because our new immigrant overlords have decided you cannot say them. Oh, yeah. And what about all the economic benefits? Turns out there are no economic benefits. And of course, what we get is alienation and loss of community and loss of freedom as well. The late Oberon Waugh pointed out that people use this term political correctness as if it's some sort of joke. But no, political correctness was devised specifically to deal with the problems brought about by immigration and multiculturalism. And are we going to get a say in whether we can have our countries back, whether we can have an economy, whether we can have society, whether we can have basic God-given civil rights? I don't know. It certainly doesn't look that way. Yes, I alluded to this earlier from the Off Guardian. Coronavirus fact check number 4. Why are so many healthcare workers dying? The deaths of doctors, nurses, and other medical workers has been a major talking point since the pandemic began. It started in Italy, where a website was set up listing the deaths of doctors who died on the front lines. Despite being billed as frontline doctors, 15 of the names are dentists. There are also surgeons, psychiatrists, pediatricians, and other specialists who obviously would not have been on the front lines treating COVID-19 patients. When Swiss propaganda research noted that many of them were retired and that the average age was over 69, the dates of birth were removed. As the pandemic has shifted focus from Italy to the UK, the deaths of NHS workers have started flooding the headlines. A few days ago, The Guardian ran a piece listing all of the NHS staff alleged to have died of COVID-19. So did The Telegraph and the BBC. As these stories have been released, we've received several emails and comments asking some variation of the following. If this is just a normal flu, why are so many healthcare workers dying? To which our response is, how many healthcare workers actually are dying of COVID-19? Although we hear a lot of anecdotal evidence and see a lot of headlines, we have no data suggesting an excessive impact on healthcare professionals. A recent statistical study published in the Health Sciences Journal provides some important facts and context. First, let's establish the data. As of April the 22nd, 119 NHS workers were reported to have died of COVID-19. 13 of them were excluded from the study for being either retired or never confirmed to work for the NHS. That left 106. Second, we should clear up the misconception that this represents just frontline healthcare workers. It doesn't. This number includes 35 nurses, 18 doctors, and 27 healthcare assistants. They are all frontline workers. But it also includes 36 others: dentists, psychiatrists, porters, administrators, receptionists, etc. Let's put these numbers into some context. The NHS is the biggest single employer in the UK. NHS England, NHS Scotland, and NHS Wales employ roughly 1.5 million people, and Wikipedia estimates over 1.7. That's 4% of the 38 million working age adults, or 2.5% of the entire population of the UK. As such, you would expect roughly 2.5% of the COVID victims to be NHS employees. However, the 106 NHS employees represent only 0.58% of the UK's 18,200 total COVID-19 deaths as of April the 22nd. To put it another way, any randomly selected citizen of the UK has a 1 in 39 chance of being employed by the NHS, but any randomly selected COVID-19 related death has a 1 in 172 chance of being employed by the NHS. We're just being lied to over and over and over again. And I'm looking at a picture of Matt Hancock, the health minister, and he's standing at a lectern, and it has a sign, kind of emergency-like sign, that says, "Stay home, protect the NHS, save lives." This gormless man standing behind these pitiful slogans, protect the NHS. Well, the British taxpayer pays rather a lot for the NHS. As Peter Hitchens has pointed out, it is the job of the NHS to protect Britons. It is not the job of Britons to protect the NHS. But apparently every Thursday, every Briton must go out and clap for the NHS. And there is no end to the disgusting TikTok videos of nurses in hospitals apparently having so much free time that they can pretend that they're rowing on a river using various bits of hospital equipment. They are saints living among us. Also from Spiked, Mick Hume writes, "The news media in the UK and worldwide has rarely seemed more important or influential than during the coronavirus crisis. Web searches for news have hit record highs, with COVID-19 dominating more than any issue on record. The British government lists journalists as key workers. Media sources praise them as the unsung heroes of the crisis. Top news correspondents have become the main public interface with the authorities, questioning government ministers and experts in front of millions at daily briefings. When the Sunday Times published a lengthy attack on the UK government response to coronavirus, headlined "The 38 Days When Britain Sleepwalked into Disaster," the UK government felt obliged to issue an unprecedented rebuttal of the allegations that was almost as long. The coronavirus crisis has clearly demonstrated the value of good journalism, yet the response of too much of the media has also shown how bad journalism can help make a terrible situation even worse. The coronavirus crisis is quite real and bad enough. It surely does not need any sensationalism or exaggeration. Yet too often it is seen that the worst-case scenario makes the best and biggest headlines. When a senior war correspondent from a top British newspaper can write that in Corona-hit London, quote, popping out to buy milk might prove as deadly as driving on Kabul's most suicide-bombed road, unquote, you know that journalism has taken a wrong turn towards apocalypticism. And who is the guilty party? It is Christina Lamb of the Times. She obviously has no sense of shame, so as I suggested earlier, perhaps the rest of us can shame her. From the start, too much of the media has seized one-sidedly on the most unrestrained and unrealistic estimated death tolls. Morbid daily reports have casually mixed up the numbers dying from and with coronavirus. In this, as elsewhere, the experts feeding the media are often as much to blame as any news outlet. News reports have singled out the atypical deaths of a few younger people with no known health problems, downplaying the fact that those dying with COVID-19 are overwhelmingly elderly and infirm. The news media should put information before the public, not put the fear of God into them. In recent years, sections of the UK media have openly regarded themselves as the real opposition to powerful governments, first to Tony Blair's New Labour and now to Boris Johnson's Conservatives. Self-important media outlets have crossed over from speaking truth to power to assuming that they should have the power to tell governments what to do. Nowhere has this been more evident than during the coronavirus crisis. Media big hitters claiming to speak for the people have repeatedly demanded that the government follow their instructions and act, often with scant knowledge of what the outcome might be. The overwhelming pressure of this shrill "something must be done" journalism quickly helped to push the UK government into changing tack and imposing a general lockdown with far-reaching consequences for society. It will also make it hard for the authorities to relax the lockdown anytime soon, faced with a chorus of media disapproval. Before the lockdown, much of the media reacted furiously to the suggestion that the UK government might pursue a policy based on developing herd immunity. They have shown no such resistance to another outbreak of a powerful herd instinct in their own ranks, imposing an air of certainty and conformity on a situation where uncertainty reigns and we should be questioning everything. With a few honorable exceptions, media outlets from left to right began by parroting the same line about the need for a general lockdown and echoing the same expert instructions on what we should and should not be allowed to do. Until recently, there was little space for alternative outlooks or interpretations, however expert or well-informed they might be. To be radical in this climate has often come to mean simply being shriller in shouting the same conformist message. In a crowded field of media outlets deserving of criticism over the coronavirus response, the BBC stands out as the worst. The corporation has turned itself into a rolling public information announcement, constantly lecturing us about how to behave and beating the lockdown drum. The BBC has tried to recreate its role in the Second World War as the propaganda wing of the state's war effort. The aim has been to establish the BBC as the voice or conscience of the nation, a sort of media equivalent of the NHS, and hence hopefully to protect it from further attacks by the Conservative government. The result has been to relegate objective news coverage in favor of hectoring and heart-strung tugging. In 1984, we might recall George Orwell-based Big Brother's propaganda department on his wartime experience of working at the BBC. We don't need another Ministry of Truth. So, what does Howard Stern think about all this? Well, according to Stern, supporters of President Donald Trump should gather for a large coronavirus rally, take disinfectant, and drop dead. The Sirius XM host made the remarks while taking a call from a Trump supporter who claimed the president was being sarcastic when he discussed using disinfectant to kill the novel coronavirus. What's it going to take? I don't get it. Stern responded, noting that he reacted to Thursday's Trump press conference by telling his wife, "I don't think there is anyone left who will vote for him." I think that Donald Trump should, get out of New York more often. The media has repeatedly said that Trump told people to inject themselves with Lysol. He said nothing of the sort. But the media has been so emboldened that they believe that they can simply repeat the same lies, and if they repeat them often enough, then people will believe them. It's been one of the most important stories that I've seen about the panic, the hysteria, since it began, appeared in the Daily Mail yesterday. And it's headlined, "Microbiologist Accuses Politicians of Hiding Behind Follow the Science Mantra to Avoid Taking the Blame Once the Pandemic is Over." Professor Hugh Pennington, a leading microbiologist at Aberdeen University, says ministers are hoping to avoid blame if anything goes wrong. Pennington, part of the 1960s team that discovered the original coronavirus. So he is obviously an expert, right? He said follow the science was meaningless because experts offered conflicting advice on how to deal with the pandemic. In a way, they are shielding themselves with science because they cannot get blamed if things go wrong. Professor Robert Dingwall, a government advisor, agreed. He added that the science was flimsy and prone to change. Well, the UK government started the pandemic with a plan to achieve herd immunity. A study by Imperial College London showed society could be hit with a huge number of deaths if it continued as normal. The first case of the coronavirus in the UK was recorded on January 31st, but the country did not go into lockdown until 2 months later, on March the 23rd. At the time, Boris Johnson said, without a huge national effort to halt the growth of this virus, there will come a moment when no health service in the world could possibly cope, because there won't be enough ventilators, widowmakers, enough intensive care beds, enough doctors and nurses, adding, I must give the British people a very simple instruction: you must stay at home. A month after lockdown was first imposed, ministers are following advice leveled by the Scientific Advisory Group for Emergencies, or SAGE, but the group has already been riddled by controversy. Prime Minister Johnson's top aide, Dominic Cummings, has been criticized for sitting in on the expert group's meetings since February. Dr. Paul Hunter, professor of medicine at the University of East Anglia, said this meant advice being given to the government could be flawed. There are a lot of similarities with what's going on now with things that have happened in the recent past. I mentioned the phony AIDS epidemic. Well, I mean, it was phony for heterosexuals and non-intravenous drug users. But we are told to listen to the science, that if you don't believe that the world's economies must be destroyed, then you are a climate emergency denier. Well, we're seeing the same thing. We're seeing bogus models and faked numbers, leading to a crisis. But I guess the destruction of the world's economies that solving the climate emergency would require, this wasn't happening fast enough. People just weren't scared enough. And as this piece in the Daily Mail demonstrates, the media in particular has been very choosy about which experts it quotes from. When someone as important in the academic community as Professor Ioannidis from Stanford, who, of course, you may have heard of the replication crisis, that much of scientific research is absolutely useless because it cannot be replicated. He was the man who first drew attention to this. There are all sorts of experts with all kinds of opinions on this, but we only get to hear from, and governments are only listening to, those experts who provide the most apocalyptic views. According to the London Sun, Boris Johnson today warned Brits against lockdown impatience as the country is at the stage of maximum risk. And how long is this period of maximum risk going to last for? In a rallying cry from outside number 10 Downing Street, the PM warned the nation he would refuse to risk a second wave of coronavirus cases by lifting restrictions too soon, as he came back to work for the first time since his own battle with the virus. The PM hasn't been seen since he made a video statement to the nation on April the 12th. He mentioned the moment of maximum risk and said we must tread carefully after reports of more cars on the roads. Oh dear. And some Brits starting to head out. Tory MPs and donors have been piling pressure to ease some measures to avoid a complete economic collapse. But the risk of a second spike would mean a new wave of deaths and an economic disaster, he said. He's already brought about an economic disaster, and with each day that goes by without any of the lockdown, the disaster becomes greater still. Toby Young has his website, lockdownskeptics.org, and he comments on Johnson's speech in which he announced, "Bugger all." For the time being, he said, there will be no easing of the lockdown. The message was the same as the one being peddled by Dominic Raab and other cabinet ministers at the daily Downing Street press briefings. The lockdowns will remain in place until the government's 5 tests have been met, and in the meantime, it would be irresponsible to set an exit timetable. According to Boris, the most important of those tests is eliminating the risk of a second spike. If the easing of social distancing measures led to a second wave of infections, that would not only be a humanitarian disaster, rendering all our sacrifices for nothing, it would also necessitate reimposing restrictions, and that in turn would be an economic disaster. So in order to protect the NHS, save lives, and rebuild the economy, we have to remain under virtual house arrest for the foreseeable future. This was deeply unimpressive from the Prime Minister. Where's the evidence that phasing out the lockdown but keeping more modest social distancing measures in place would lead to a second wave? As Lyman Stone points out in an excellent essay in Public Discourse, the burden of proof isn't on lockdown skeptics to show that they don't work. Rather, the burden of proof is on the lockdown advocates to prove that they do. If you're going to essentially cancel the civil liberties of the entire population for a few weeks, you should probably have evidence that the strategy will work. And there, lockdown advocates fail miserably because they simply don't have any evidence. Stone is an economist specializing in population and demography, and he looks at the effect of the lockdowns in Spain, Italy, and France, and compares them with the mitigation strategies pursued in Sweden and Holland. His conclusion: lockdowns have made no difference when it comes to reducing COVID-19 deaths. To check this, he crunches the data from the US, comparing COVID mortality rates in those states that have locked down with those that haven't, and finds that for every 2 weeks a stay-at-home order is in place, the death rate actually increases by 1 person per 100,000. That is to say, lockdowns actually have a negative effect on COVID mortality. We don't need to have a national debate about whether the economic costs of lockdowns outweigh their public health benefits, because lockdowns do not provide public health benefits. Stone isn't a COVID denier. He thinks wearing masks should be mandatory and social gatherings of over 50 people should remain prohibited. And there is another study from Professor Wilfred Riley, which is called "There's No Empirical Evidence for These Lockdowns," complements that of Carl Hennigan, professor of evidence-based medicine at Oxford, who argues that infections peaked in the US before the lockdown was imposed. According to Professor Hennigan, the data shows infection rates halved when the government launched a public information campaign on March 16th, urging people to wash their hands and keep 2 meters apart. That's clear from the fact that deaths peaked on April 8th, almost exactly 3 weeks later. He believes the government lost sight of the evidence and rushed into a nationwide quarantine on March 23rd after being poorly advised by scientific experts who have been consistently wrong during the crisis. Professor Hennigan praises Sweden for holding its nerve and avoiding a doomsday scenario. In addition to this, there are the analyses showing that the rise and fall of infections and deaths follows the same pattern wherever the virus is struck, regardless of whether the country or region in question has imposed a lockdown or how severe that lockdown is. I'm thinking of the work of Professor Isaac Ben Israel, the head of the Security Studies program at Tel Aviv University and the chairman of Israel's National Council for Research and Development, showing that the virus largely vanishes 70 days after it strikes, no matter what strategies are put in place to contain it. There's also analysis by Phil Nuttridge, an ex-scientist with a master's degree in statistics, showing that infections peak between 31 and 33 days after cases first start appearing. He looked at 6 different European countries and detected the same pattern in all 6, irrespective of their varying population densities, testing rates, case levels, and mortality rates, and in spite of the severity of the lockdowns they've imposed and when they imposed them. Of course, there are plenty of epidemiologists and virologists who still believe lockdowns have been effective, such as Professor Neil Ferguson, who seems to be emerging as the UK's answer to Dr. Strangelove. In an interview in Unheard on Saturday, Professor Ferguson refused to row back on his previous claims that absent a lockdown, 250,000 Britons would die of COVID-19. If we ease off now, he said, more than 100,000 would die before the end of the year, even if we continue to quarantine the elderly and vulnerable. He reiterated that the only viable exit strategy is a vaccine. In the interview, Professor Ferguson says a majority of epidemiologists are on his side in this debate, and that may be true, but how reliable are the predictive computer models they're using? The more scrutiny the Imperial College model is subjected to, the less well it holds up. Readers of this site will be familiar with the skepticism of John Ioannidis, professor of medicine at Stanford, who says some of the assumptions and estimates built into the ICL model are substantially inflated. But readers may not be familiar with a new working paper published by the National Bureau of Economic Research. Jointly authored by a team of health economists from Harvard University and MIT, it's highly critical of the predictive models used by epidemiologists in general, and particularly Professor Ferguson's. The paper is quite technical, but thankfully Philip Magnus has summarized the main criticism in an article for the American Institute for Economic Research. The gist is that the ICL model predicts how many people are likely to die from COVID-19 in various different scenarios without allowing for the way in which people adapt to the risk of infection over time. For instance, the model claimed 510,000 people in the UK would die if the government did nothing to mitigate the impact of the virus, and 2.2 million in the US, ignoring the fact that as people learned more about the disease, they would take more and more precautions, whether told to by the government or not. If that is a flaw in the ICA model, then it's insufficiently dynamic to accurately predict the response to the virus over time. That would jibe with Carl Hennigan's analysis showing that infections peaked before the lockdown was imposed. That indicates Professor Ferguson's March 16th paper underestimated the impact of the mitigation measures introduced by the government that same day. The authors of the NCER paper say of the ICO paper and four others based on epidemiological models, in sum, the language of these papers suggests a degree of certainty that is simply not justified. But let's suppose Professor Ferguson is right and an easing of the lockdown would see an uptick in infections. Is that a good reason not to do it, as Boris Johnson said this morning? The $6 million question is whether the NHS would be overwhelmed if we return to a mitigation strategy, and the March 16th ICL model is flawed in that respect because it underestimated the NHS's emergency surge capacity, another example of the model being too static. Critical care capacity has now been significantly increased. The number of ICU beds in the UK has doubled, not counting the ones in the new Nightingale hospitals. According to the ICL model, that means you could ease back on some of the extreme social distancing measures without overwhelming the NHS. Again, you know, Professor Ferguson has been proved wrong and wrong and wrong over and over again. But like Dr. Anthony Fauci, he's bulletproof for some reason. Yeah, of course, he is not a physician. There's no medical training, but I guess that doesn't make any difference. In his Unheard interview, Professor Ferguson claimed that more than 100,000 people would die of COVID-19 by the end of the year if we end the lockdown now and merely isolate the elderly and the vulnerable. But as he told the House of Commons Science and Technology Committee, 2/3 of the people who've already succumbed to the virus would have died by the end of the year anyway, given their age and underlying health conditions. Do we know the same doesn't apply to those that would die of COVID-19 if the lockdown was lifted? If it does, then Professor Ferguson's argument is not that more than 100,000 people will die by the end of the year if we ease the lockdown, but about 1/3 of that number. And for that to be a persuasive argument for maintaining the status quo, he'd have to show that keeping the lockdown in place will result in a lower loss of life, which is implausible given the impact on public health of the looming economic catastrophe. Even if we ignore the toll on human life the economic contraction will cause, in the developing world, where a global economic recession will likely see tens of millions of people starve to death, there's plenty of evidence that the lockdown has already had a negative effect on public health. There's a good article in today's Financial Times by Sebastian Payne documenting the costs the lockdown has incurred in terms of mental health, domestic violence, and people failing to seek medical help for strokes, heart attacks, and cancer symptoms. As he points out, one internal government estimate puts the lives likely to be lost by the neglect of non-COVID-19 patients at 150,000. Yes, there are risks in any strategy, and it's a question of balancing the risks. And Boris Johnson and governments around the world have simply decided to go for panic because that's what the Karens were demanding. And I guess you just don't say no to the Karens. News from Germany. German police wearing riot gear and face masks tussled on Saturday with dozens of protesters demonstrating in central Berlin against the coronavirus lockdown and public life. Protesters shouted, "I want my life back," and held up signs with slogans such as "Protect constitutional rights," "Freedom isn't everything, but without freedom, everything is nothing," and "Daddy, what is a kiss?" Police said on Twitter they had arrested more than 100 people. The protesters handed out newspapers entitled Democratic Resistance, which said the new coronavirus is an attempt to seize power by spreading fear. The papers quoted 127 doctors from around the world who questioned the need for strict lockdowns. Police spokesman Thilo Kablitz said permission had been granted for a newspaper distribution campaign, but the health authorities had not granted permission for a public demonstration. Is that part of the new normal? That healthcare experts will give a yes or no when people want to protest? Germany's constitutional court ruled earlier this month that people have the right to hold protests if they adhere to social distancing rules after pro-democracy activists brought a case arguing that the lockdown breaches freedom of assembly. On Saturday, some protesters sat peacefully on the ground at a distance from each other holding white roses in reference to the White Rose Resistance movement against the Nazis. Let's go back to the chat. Who cares about the WHO, says Alan Christina. Well, a lot of people seem to care about the WHO. They're the experts. Apparently, they trained the universally beloved Bonnie Henry. Alex Delarge says Trump definitely stepped in it. He's a layperson. All the reasons to not spew out the first idiotic ideas that enter his mind. I don't know about that, frankly. We have seen that confidence in the media has absolutely collapsed. And with them repeating over and over again that he was telling people to inject themselves with Clorox or Lysol, well, obviously not. Alex Delarge says he was talking about disinfectants, which the doctor he was with gave a presentation of for surfaces. Talking about isopropanol specifically, and talking about UV light treatments, which are actually used currently in other circumstances. Let's see. Eternal Fisherman says, based on everything you know, for how long do you expect the virus to stay on a larger scale? Well, if they're going to diagnose everyone with COVID-19, even if they've not been tested, and even if they have no symptoms, well, I guess it's going to be around for a long, long time. The vaccines we develop will be short-acting and reserved for high-risk individuals. Well, everyone's going to be clamoring for them, I would think. And it'd be very difficult for governments to say, well, important people get them, but you don't. Okay. I'm low-key into conspiracy theories, to be honest, as Eternal Fisherman Fauci said comparatively recently that he is almost 100% sure that immunity will at least last for several months, and now all of a sudden it's nah. Well, I guess he doesn't want to fade into the background. And I suppose if he becomes less powerful than he is today, people will start asking questions about, you seriously outsourced the creation of monster viruses to China? You actually did that? And why don't you tell us about your relationship with Bill Gates? I don't think he wants to hear those questions. Okay. Eternal Fisherman says, but the WHO suggested only elderly patients produce enough antibodies and most others totally not. Yeah. Yeah, well, apparently there's never been viruses before, and there's never been epidemics of disease in the United States before. This is completely different and requires a completely different reaction. Specifically, you have no more rights, and first we're going to decide what are essential jobs, then we're going to decide what is essential travel, and finally, when it's already happening, they are deciding who are the essential people and who can be condemned to die. According to the Daily Mail, the UK today announced 360 more coronavirus deaths, the lowest daily count recorded since March 30th, when just 180 fatalities were registered. Well, as I pointed out before, people have been given the impression that all of the deaths that occurred, yesterday were counted, and they are not. These deaths, recordings of death, come in over a period of quite a few days. So the statistics are completely unreliable in that respect. Now, yes, I mentioned Lyman Stone's essay, Lockdowns Don't Work, from Public Discourse. And I wonder if what he has to say about, no, he doesn't mention Neil Ferguson specifically. And let's see whether Wilfred Riley has anything to say about Neil Ferguson. I'm just rather shocked that this man is taken seriously, or that everyone is not reporting on his many failed predictions. The original response to COVID-19, Riley writes, was driven by an understandable fear of an unknown disease. Neil Ferguson projected that 2.2 million people could die in the US alone, and a few world leaders were willing to risk being the one who would allow such grim reaping to occur. However, as time has passed, new data have emerged. A top quality team from Stanford University has pointed out that the infection rate for COVID-19 must logically be far higher than the official tested rate, and the fatality rate for the virus could be thus much closer to 0.1% than the 2 to 4% that was initially expected. And empirical analyses of national and regional response strategies, including this one, do not necessarily find that costly lockdowns work better against the virus than social distancing. It should be not taboo to discuss these facts. Let's see, Charles Hugh Smith of the Two Minds blog, which I highly recommend, has a piece which is repeated on Zero Hedge. And there's an amusing sign on a building saying, sorry, the lifestyle you ordered is currently out of stock. It's headlined, no, this is not another 1929, 1973, 1987, 2000, or 2008. Like addicts who cannot control their cravings, financial analysts cannot stop themselves from seeking some analog situation in the past which will clarify the swirling chaos in their crystal balls. So we've been swamped with charts overlaying recent stock market action over 1929, 1987, 2000, 2008, though the closest analogy is actually the oil shock of 1973, an exogenous shock to a weakening, fragile economy. But the reality is there is no analogous situation in the past to the present, and so all the predictions based on past performance will be misleading. The chartists and analysts claim that all markets act on the same patterns, which are reflections of human nature, and so seeking correlations of volatility and valuation that worked in the past will not work in 2020. Does anyone really believe the correlations of the past decade or two are high probability predictors of the future, as the entire brittle construct of fictional capital and extremes of globalization and financialization all unravel at once? Here are a few of the many consequential differences between all previous recessions and the current situation. 1, households have never been so dependent on debt as a substitute for stagnating wages. 2, real earnings, adjusted for inflation, have never been so stagnant for the bottom 90% for so long. 3, corporations have never been so dependent on debt, selling bonds or taking on loans to fund money-losing operations, see Netflix, or stock buybacks designed to saddle the economy with debt service expenses to enrich insiders. 4, The stock market has never been so dependent on what amounts to fraud, stock buybacks to push valuations higher. 5, the economy has never been so dependent on absurdly overvalued stock valuations to prop up pension funds and the spending of the top 10% who own 85% of all stocks, i.e. the wealth effect. 6, the economy and the stock market have never been so dependent on central bank free money for financiers and corporations, money creation for the few at the expense of the many, what amounts to an embezzlement scheme. 7, federal statistics have never been so gamed, rigged, or distorted to support a neo-feudal agenda of claiming a level of widespread prosperity that is entirely fictitious. 8, major sectors of the economy have never been such rackets, i.e. cartels and quasi-monopolies that use obscure pricing and manipulation of government mandates to maximize profits while the quality and quantity of the goods and services they produce declines. 9, the economy has never been in such thrall to sociopaths who have mastered the exploitation of the letter of the law while completely overturning the spirit of the law. 10, households and companies have never been so dependent on free money gained from asset appreciation based on speculation, not an actual increase in productivity or value. 11, the ascendancy of self-interest as the one organizing directive in politics and finance has never been so complete, and the resulting moral rot never more pervasive. 12, the dependence on fictitious capital masquerading as wealth has never been greater. 13, the dependence on simulacra, simulations, and false fronts to hide the decay of trust, credibility, transparency, and accountability have never been so pervasive and complete. 14, the corrupt linkage of political power, media ownership, national security agencies, and corporate power has never been so widely accepted as normal and unavoidable. 15, primary institutions such as higher education, healthcare, and national defense have never been so dysfunctional, ineffective, sclerotic, resistant to reform, or costly. 16, the economy has never been so dependent on constant central bank manipulation of the stock and housing markets. 17, the economy has never been so fragile or brittle and so dependent on convenient fictions to stave off a crash in asset valuations. And finally, 18, never before in U.S. history have the most valuable corporations all been engaged in selling goods and services that actively reduce productivity and human happiness. Yes, what this new normal is has yet to be defined, but it is liable to be, let's say, much less comfortable than the old normal. The American Institute for Economic Research, how wrong were the models? It asks. And, oh, they have something to say about Professor Ferguson? Yes, indeed, they do. The ICL lead author, Neil Ferguson, reported the 2.2 million death projection to the New York Times' Nicholas Kristof as the worst-case scenario. When Kristof queried him further for a best-case scenario, Ferguson answered about 1.1 million deaths, a projection based on a modest mitigation strategy. It is worth noting that even at the time of its March 16th public release, the condition of the ICL's do-nothing scenario were already violated, rendering its assumptions invalid. Most governments had already started to do something by that point, whether it involved public information campaigns about hygiene and social distancing, or event cancellations in the early stages of the lockdown, which began in earnest a week earlier. Voluntary behavioral adaptations also preceded government policies by several weeks, with a measurable uptick in hand washing traceable to at least February, and a dramatic decline in restaurant reservations during the first 2 weeks of March. When read in this context, Ferguson's decision to hype the extreme death tolls of the do-nothing scenario to the press in mid to late March comes across as irresponsible. A month later, it has become readily apparent that the 2.2 million death projection was off by several orders of magnitude, as was its UK counterpart of 500,000 projected fatalities. Ferguson and the ICL team shifted their public commentary to emphasize other scenarios with more conservative projections in the tens of thousands. In some cases, although it actually used the milder scenarios in the original March the 16th paper. Nevertheless, damage from the overhyped ICL do-nothing scenario was already done. Indeed, as of this writing, President Trump is still citing the 2.2 million projection in his daily press conferences as the underlying rationale for the lockdowns. April the 18th, and even a month later, it remains something of a social media taboo for a non-epidemiologist to scrutinize the underlying statistical claims of credentialed experts such as Ferguson. Stay in your lane. Emphasis of his public comment changed, but Ferguson's model, which I will repeat, is thousands of lines of undocumented C code that he will not release to the public, written 13 years ago. And of course, you obviously let one man determine a policy which is going to lead seriously to the end of the world as we know it. That seems like the responsible thing to do, doesn't it? So what are the latest numbers from my own country? Okay, and can we get the text description here? Come on, come on, come on. Let's see, 48,500. Almost 48,500. Deaths, 2,707. Oh, I see the number of cases in Saskatchewan, population 1.1 million, has reached 365, and the number of deaths has rocketed up from 4 to 5. In my own province of British Columbia, there are 1,998 cases. That, again, is in a province of 5.1 million people, and there have been 103 deaths, a very large number of them at old age homes, which failed to protect their patients. And so what is going on in Vancouver Island, which is where I live, and so I have a particular interest in that. BC officials announced 50 new COVID-19 cases, 3 more deaths. I find it infuriating that there's one rule for the whole of the province, and British Columbia is a very large province. It's bigger than the entire country of France, and all sorts of conditions are very different in British Columbia, but it is one size fits all. If you look at the number of cases that there have been, say, in the north of British Columbia, almost none, but they have to stay locked up as well, as if the conditions there are anything like the conditions in Greater Vancouver. Was it perfect? No. Top doctor discusses Canada's early pandemic response. And again, this is the sainted Dr. Theresa Tam, born in Hong Kong. So let's recap. Theresa Tam told Canadians that COVID-19 was not a big deal. There was no evidence that could be communicated from person to person, and that the real killer was stigmatization. There was no reason to restrict travel to Canada from any part of the world. Why does this woman still have a job? Oh, was it perfect? No. She discusses Canada's early pandemic response. Could we have done more at the time? You can retrospectively say yes. Why isn't the media howling for this woman's job? She turned on a dime and said everyone has to be locked up until when? Forever? Maybe? Till we get a vaccine? When will that be? Nobody knows. And this is the woman who's in charge of our national response. As a rather amusing story from the Hill Times, which is an Ottawa paper which covers politics in great detail, that, let's see, that we need to study the cultural, understanding cultural traits key to effective COVID response, says professor. And that professor's name is Umar Ruhi. And I'm thinking, yes, certainly a fellow called Umar Ruhi would know all about Canadian cultural traits. And the most irrelevant question, certainly in Canada this year, but in Canada in many years, is asked by Chantal Hébert, who is a columnist for the Toronto Star. Canadians know what she looks like because she appears on television so often. She is the voice of Canadian received opinion. And she asked the bold question, will COVID-19 derail Canada's action on climate change? This is of no interest to anyone. In fact, the secret here is this climate change, global warming, climate emergency was never of interest except to the elite and the aspirational class rather. And I suppose, the goals of the climate emergency people have been met. They wanted to destroy Canada's economy and the economies of the West, and now Canada's economy and the other economies of the West are being destroyed. And a destroyed economy is obviously going to produce less carbon, right? This is the sort of thing that Canadian political commentators, this is the sort of thing that they worry about, that they seriously worried about. Yeah, there's this disease which is going to kill us all unless we're locked up forever. Won't somebody think of climate change? We're in danger of forgetting about climate change. That can't happen. Okay, so I mentioned Netflix earlier, and I was curious that Community was trending. Community was a TV show that ran from 2009 to 2015. It's trending because it's on Netflix now, and it is ranked in the top 10 Netflix programs in terms of numbers of people who watched. And I wanted to say some things about Community. It is my favorite television show. That is to say, of all the television shows that have ever been made, this one is my favorite. It's about a group of students at Greendale Community College in Colorado. Of course, this is TV Colorado, because if you've ever seen the show, you would be asking yourself, how could they be in Colorado when there's never any snow on the ground? But I suppose that's one of the things we get used to in TV shows. There was a video which I recommend called "What Makes Community Great: The Heart Within the Chaos" from Story Street. And I mean, I noticed this at the time that the show started, that people on TV shows have wacky adventures, right? And then the next week it goes back to everything being the same as it was, and this becomes tiresome. A Community gets away with its wacky adventures because the stakes are so low. Who are the people who go to community colleges? Well, there are people who, for various reasons, are not up to going to normal colleges or universities. And many of them are there for odd reasons. Some people like to hang around schools. Some people like to hang around other people. You have devotees of lifelong learning. And the people in this show are an odd bunch. The title Community refers to the fact that it's not only set in a community college, but this study group of the main characters are designated a community by Jeff Winger, who is the leader of the group. He's played by Joel McHale. Now, he is an ex-lawyer who found himself disbarred or suspended when it turns out that his degree was faked. So he has to go to some educational institution to get credits, and he has chosen the one which requires the least work from him, because he's a lazy man who has gotten by in life with his golden tongue. And the reason that this group gets together is because there is a beautiful young woman called Britta Perry, who he sees, and oh yes, I'm a board certified Spanish tutor, as if there could ever be such a thing. And so she decides to invite a whole bunch of her friends, and Jeff Winger attempts to bail on them, and he is shamed out of it. Britta is, as I say, I don't know, what was it Mark said on Peep Show? Good looks, low self-esteem, the perfect combo. She's a very annoying woman, but she's very vulnerable as well, because she knows that most of the things that she says are nonsense. She's very aggressive in her promotion of atheism and environmentalism and the like. And apparently she used to be a serious anarchist, whatever that might mean. But now she's at a community college, and oh, she used to live in New York City, and she mentions that a lot. Abed Nadir, played by Danny Pudi, who is, let's see, he is half Polish and half Hindu. His character in this show is half Polish and half Palestinian. He is an autist. He is obsessed with television shows and movies, and he harbors the illusion that life is actually scripted, or that it could be scripted, or that it is very much like a TV show or movie. And he, for instance, he warns against spoiler alerts, and this is pointed out to him. There is no such thing as spoiler alerts in real life. Yvette Nicole Brown plays Shirley Bennett. She is a black Christian woman in her 40s whose husband left her for a stripper. And she is a good person, but she is constantly guilt-tripping people. And she makes many humorous attempts to convince people of the virtues of Baptist Christianity, and she gets nowhere. The lovely Alison Brie, who I've spoken of on this show previously, plays Annie Edison, who is, I believe, 19 years old. She lost her scholarship when she became addicted to Adderall, and she ran through a plate glass window screaming, "You're all robots." She's kicked her drug addiction, but she is as organized as Britta Perry is unorganized. And Donald Glover plays Troy Barnes, who is a black former high school quarterback star, who had a scholarship which he injured himself deliberately because he didn't actually want to be a jock anymore. And he's played by Donald Glover, who is one of the funniest men in the world. And Chevy Chase plays Pierce Hawthorne, who has been going to Greendale forever, it would seem. His father's company dominated the sanitary hand wipes business, and so he has a few $1 million. He is, well, he says, "I say things others won't, that has value," and it does have value. He is, he's socially inept to the point where it's difficult for him to say anything without offending someone. And he seems to be rather unaware of this. He is constantly making fun of Abed, who he calls Abed, for being a foreigner and for being an autist, but he doesn't seem to realize that his own behavior is rather autistic itself. And we have Ken Jeong as Ben Chang, who is a Spanish teacher at the school, and it turns out that, like Jeff Winger, he is a complete phony. He later returns as a student. And the dean, Craig Pelton, is played by Jim Rash, who's also a screenwriter, and he is a pansexual imp. There is apparently no limits to his sexuality. However, he is treated as a figure of mockery in the show. There is no attempt to make him brave or noble in any way. Now, one of the things I very much liked about Community is that typically in sitcoms now, and for some time, if you have black or other minority characters, everyone worships them because they have so much wisdom to impart. Or, the black males are all brothers be pimpin', and the females are all sassy. Community treats these minority characters just as people instead of tropes, which pays great dividends. Community is a very, very funny show indeed. I recall that they did a parody of Goodfellas, and Abed was very keen on this because he always wanted to take part, in a mafia movie. And there is a musical cue which appears in the show, and it's the second half of Layla with Jim Gordon playing the piano, the same one that was used in Goodfellas, and I laughed so hard I nearly fell off the couch. This is a show which, I don't know, it's been described as, clever. And what that means is you don't want to watch it because apparently clever is a very bad thing nowadays. You don't want to be clever. But it is clever, and it is constantly doing things that are unexpected. For instance, a clip show in which almost all of the clips are new material. I remember watching that episode and thinking, clip shows. Oh, what, there's going to be like 4 minutes of new material and stuff I've seen before, but no, it was like 4 minutes of old material, and all the rest was stuff I hadn't seen before. Other shows will give you, let's say, a Halloween episode, but Halloween happens every year. So on Community, we got a Halloween episode every year. One of which had everyone becoming zombies because they were infected by discount meat that the dean had bought from the U.S. Military. And in another Halloween episode, Britta thinks she is an expert on human behavior. She also has a sideline in really terrible black and white photography. And she decides she is going to become a psychologist, and she administers a test to all of the members of the study group, and it turns out that one of them is a psychopath. We don't really know who that is, but Britta becomes obsessed that all of them are psychopaths, or all of them could be a psychopath. And we have some very funny stories told, fantasies of the group. And I have to say that Annie's fantasy is particularly touching because she plays a young maiden who meets Jeff Winger, and it turns out that Jeff Winger in this fantasy can't read, and that he's a vampire who feeds off Britta, because the group has found out that Jeff and Britta have been hooking up, which they kept secret. And there's a kind of a sitcom law that you can't have this hooking up within the group because it is quite like incest. I used to joke that the reason that Friends went off the air was because every single sexual possibility, outside of homosexuality or incest within the group had been tried. But Britta in this fantasy says she doesn't mind, being locked in a closet and being used as a human blood bag by Jeff. And then Jeff has a request of Annie, which is, teach me how to read. And you see him start with, the cat sat on the mat, very hesitantly, to him reading Shakespeare with great suaveness. And of course, Pierce considers himself to be quite the ladies' man. And he's constantly boasting about the women he had sex with, including famous women, supposedly such as Eartha Kitt, who appears prominently in the episode about alternate timelines, which is certainly one of the most daring shows ever made on television. And we get to hear Chevy Chase 5 or 6 times talking about how he banged Eartha Kitt in an airplane bathroom. The very idea of having sexual intercourse in an airplane bathroom is horrifying. I mean, you do not want to stay in an airplane bathroom for 1 second longer than usual. Now, the video that I referred to talked about the heart of this show. Sitcoms typically expect you to care about people who are not likable. I mean, Cheers was an example of that. No one on that show was likable at all. They're all nasty people. But you see this again and again in sitcoms that, oh no, they're actually lovable. No, we're being manipulated into liking people who shouldn't be liked. Now, of course, Seinfeld broke the mode there because the characters on Seinfeld are not very likable, but there's no attempt to make them likable. The characters on Community are likable, although they are all deeply flawed. And many sitcoms, they have a heartwarming moment at the end, which is not heartwarming at all. It's just gross manipulation. But I have to say that Community, many times, was genuinely heartwarming, such as the first Christmas episode where Jeff doesn't want to take part because he keeps pointing out it's December the 11th, and he's referring to the fact that Christmas parties get pushed earlier and earlier in the year. And so he gets challenged to a fight by Anthony Michael Hall, of all people, who's some deranged gym rat. And Shirley, what would baby Jesus do? She does not want him to fight. And of course, he's not going to back out of this. And a fight takes place. And they're all injured, but they all get back together. Interestingly, the creator of the show, Dan Harmon, said that he made a mistake in that episode because it was decided to have a non-religion specific Christmas party, a Winterfest sort of thing. And Shirley fought against this, and Dan Harmon said that he should have given Shirley the win there. Dan Harmon is an exceedingly talented man, very funny man, and of course he works on a different show now, Rick and Morty, which is it's a very dark show. It's very nihilist. Apparently life is meaningless. We're just random atoms in a stochastic universe. The show is much more explicit and much nastier than Community was. I think one of the advantages of actually being on broadcast television is that things have to be toned down. On cable, you can be as raw as you like. In fact, you can be rawer on cable than you can on the movie screen. The director of Autofocus, Paul Schrader, said that he wanted that film. He thought it was going to be like in tone to be like 6 Feet Under, and he was informed that if 6 Feet Under were a movie, it would be rated, what do they call it, NC-17, and no studio would distribute it. But I don't know, the Christmas episode, I thought the first one was tremendous, but then after Christmas, there was an entire episode that was based on the idea that Kentucky Fried Chicken had a rocket simulator in the 1970s. And it's largely what they call a bottle episode, in which this simulator gets hijacked by a rival community college, and they have to figure out how to get it back. I'm trying to remember if this was the first bottle episode. The first bottle episode was when Annie lost a pen, again, purple pen, which he thought was stolen. Actually, it turns out that it wasn't stolen. I won't spoil the surprise. The surprise has not paid off for like weeks later, and it's a pretty shocking surprise. But you have all these characters. Typically, sitcoms use bottle episodes when they need to save money, because that you don't need props. You're not going to have other actors there. You're shooting in one location, and bottle episodes are typically quite generic. But we learn an awful lot about the characters, such as that Abed is tracking all of the women's menstrual cycles. And Shirley says, this is so disturbing and so accurate, when she sees his notebook. And he explains that he had trouble interacting with the other members of the group, and more so with the women than the men, and particular days were particularly bad. So he started, making some calculations, and this became more and more specific. And he found out that it was quite useful to him, because he knew to tone down his behavior, to offer the women chocolates and such like. Actually, I could talk about Community for a long time, but I hope that I've given you some reason to watch the show if you have Netflix. I have not watched season 4 because it's not canonical. Dan Harmon was fired after season 3 because he had a habit of going to the last possible moment and going over budget and such like. And Community was always a marginal show in terms of its ratings. And then they brought in 2 new showrunners, and I decided I wasn't going to watch it, and so I didn't. And then, remarkably, NBC hired back Dan Harmon for a 5th season, and NBC dropped the show after 5 seasons, and it was picked up for 1 final season by Yahoo. So there was a little more freedom there. But still, not over the top. I thought that the show went out very, very, very well, even though Donald Glover had left, which was a tremendous loss. Yes, Shirley Bennett's character was gone too, and so this often happens in sitcoms where who's that guy, who's this woman, But I think that they. I think that they handled it as best as possible. A lot of people were very satisfied that it went to 6 seasons because there was a meta joke within the show, and if you don't like meta jokes, I guess you're not going to like Community. That 6 seasons in a movie. Now, this was referring to some Batman show, but the phrase 6 seasons in a movie got attached to Community itself. And so there was a 6 seasons. As to whether there's a movie, apparently Dan Harmon is up to it. Paget Brewster, a woman I find very attractive, was a major player in season 6, and it was a pleasure to see her. Anyway, those are some of my thoughts on Community. I will go back to the chat one more time. Okay, a lot of people arguing with Alex DeLarge in the chat. Okay, I will say it's 4 years old, but Fauci said that in all the decades of his work, that was basically always the case. Let's see. KMG is an intelligent man, says, what is that? Anran, and has noticed often how experts are wrong. I don't like to be, I don't like to be too cynical, but we've gotten used to governments and agencies lying to us routinely, and we don't seem to be outraged. A.N. Wilson noted in his biography of Hilaire Belloc, Belloc and G.K. Chesterton were very active in what you might call activist journalism. And, so that is a long tradition in Britain. And of course, since the 1960s, Britain has had Private Eye magazine. But Wilson said that it's distressing that the more the British people learn about the corruption of the rulers, the less they seem to care. Do I like corner gas? I thought it was okay. I mean, I suppose it was rather remarkable because Canadian shows are typically horrible. I mean, Corner Gas might be the first sitcom, Canadian sitcom, that was any good. I mean, sitcoms have been, dominant on television for what, going back to the 1950s, 1940s, and Canada didn't seem to know how to make a decent sitcom. Anyway, that's the show for today. I will be back tomorrow at 4 p.m. Pacific, 7 p.m. Eastern. If you like the show or any part of it, I would appreciate it if you click the like button and subscribe to my YouTube channel if you have not already. If you would like to support the show, my PayPal address is kevin_grace@hotmail.com. And I will leave you with my traditional benediction that in these days of total atomization, I hope that you all manage to find some genuine human contact. Good night.